Hello, my name is Dr. Joe Ebner. I'm the Chief Medical Officer at Speare Memorial Hospital in Plymouth, New Hampshire. This is a COVID-19 update intended for the greater Plymouth community in central New Hampshire. Today's date is September 3rd, 2021. It's been a couple of months since our last update, and that's because in the spring of 2021, as thousands of New Hampshire residents were becoming vaccinated against the COVID-19 virus, we saw a decrease in the number of COVID cases, the number of hospitalizations, and the number of deaths. But in August of this summer, the Delta variant of the COVID virus arrived to our state. We were, back in the spring, down to 10 to 20 hospitalized patients with COVID. In the month of August, we've been hovering in the 120, 130 range. This Delta variant is sweeping across the world and the country, putting the unvaccinated back into the hospital and increasing the death toll. So what is this Delta variant? Well, first, let us take a quick look at biology. All living organisms go through mutations. This is how we adapt over time to our environment. A living organism will pass on those survival genes to the next generation. The Delta variant of the COVID-19 virus has found a way to be more communicable, meaning more transmissible to other people. What does this mean? It means that if we think about the original COVID-19 virus, one infected person was expected to transmit the virus to 2 to 3 others. This Delta variant has increased that infection rate so that one infected person is expected to transmit this to 4 to 6 persons. It is still spread in the same way, through droplets coming from respiratory secretions from infected persons. It's passed through sneezing, coughing, and close contact. Masks will continue to help decrease the spread of this virus. We can look around the country to areas that are experiencing large increase in COVID infection. But we don't need to look far. In Kentucky, Governor Sununu and a select group of healthcare state officials, including our CEO, Michelle McEwen, visited for a day this week and learned of some of the ways that the Kentucky hospitals are dealing with the COVID virus. The take-home message was that currently in Kentucky, the critical care beds in the state are running at 200% capacity. That's a huge number, and the health officials and the hospital officials in Kentucky urged us to move forward with what we can do to prepare for another wave. One of the interesting things that we're seeing with this wave is that more children are being affected. They're not available to get the vaccine because it's not indicated for children under the age of 12. Although we're seeing more children fall ill and be hospitalized with COVID across the country, we're not seeing an increased death rate with these children. This week when I did the research, there are still less than 400 children across the country since the beginning of COVID who succumbed to the illness. But what about our New Hampshire experience? Since the vaccine became largely available in the winter of this year, over 98% of all COVID hospitalizations and deaths are in unvaccinated persons. Speare has seen an increase in hospitalizations with COVID in the past 2 weeks, and also noticed that these persons are largely unvaccinated and tend to be a little younger than the first wave we experienced. What has been the New Hampshire hospital response? We are more ready than ever before to deal with the upcoming surge. New Hampshire hospitals have put ourselves into regions where we can daily text each other if we are in need of help with nursing, beds, or transferring of patients to hospitals that might have added capacity. Although our hospitals are getting full, we still have capacity to care for the citizens of New Hampshire. New Hampshire is not expected to need alternate care sites with this upcoming surge. The New Hampshire Hospital Association has encouraged a vaccine mandate for all healthcare workers. Speare Hospital supports this recommendation and announced this week that our staff and workers will be expected to be fully vaccinated by November 30th, with appropriate exemptions for medical and religious. Medicine also knows more now about how to care for persons with COVID, with different types of positioning, oxygen support, and medications. We hope that when people are critically ill with COVID, that fewer will die. The state is also preparing for an increase in children admissions to the hospitals, with Dartmouth leading the way. So the hospitals are doing everything we can to prepare to care for the sick this fall. But why wait to become sick? The severe illness, hospitalization, and death from COVID is nearly 100% preventable. You don't need to feel anxious, worried, or fearful. Just get vaccinated. We heard a lot over the last couple of years about how this virus is novel, new, unprecedented, surge, pandemic. Well, I hope to also begin a conversation of hope, because we can also use the word preventable. Vaccines, the COVID virus vaccines, are indicated for all eligible people over the age of 12, unless you had a severe life-threatening reaction to the first shot, which is extremely rare. Your healthcare provider can help you determine whether your reaction may or may not have been severe or life-threatening. The other few people that are not candidates for the COVID vaccine are those that might be allergic to a component in the vaccine. Medicine, doctors, nurses, pharmacists, researchers feel the COVID vaccine is safe for nearly all people, including those who are pregnant, lactating, or considering pregnancy. We know from vaccine studies and now real-world experience that they are safe. In America, there are a number of vaccines that have been granted emergency use authorization by the FDA. Please understand that these vaccines went through the same rigorous studies, but the process was streamlined to get these vaccines to the public during the time of the pandemic. Just this week, the FDA granted approval to the Pfizer vaccine, indicated for persons over the age of 16. This Pfizer COVID vaccine is now FDA approved, just like all other medications and vaccines found in our country. I am certain the FDA will approve the other vaccines in the coming months. What is the mRNA vaccine? Although it is genetic material, it is not DNA. The mRNA vaccine, briefly, works by injecting a small segment of the virus mRNA into the person. The person's body takes up that virus, or that piece of mRNA, and the mRNA does not get into the patient's DNA. It does not get into the middle of the cell called the nucleus. It stays in the outer aspect of the cell called the cytoplasm. The mRNA instructs a certain protein to be created, and that protein sits on the cell wall. Your body then identifies that protein as foreign and develops an antibody response. After a number of days or weeks, that cell will die, like all cells die, and the mRNA will die with it. It will no longer be in your body. But that memory of the mRNA, of that protein, that memory that we call the antibody, does linger, so that if you are exposed to the virus at a later date, the body will mount a response against that virus prior to your body's mounting a response, and it will prevent you from getting sick, needing hospitalization, and maybe even dying. What we do know since large amounts of vaccination is that the immunity seems to be variable. So there's a small group of people who are indicated to get a third dose of the virus, of the vaccine, roughly 1 month after the last. For those of you who may be undergoing active cancer treatment and are currently immunocompromised, for patients who have had an organ transplant and are immunocompromised, for patients who have had stem cell transplant in the last 2 years and so are immunocompromised, and for patients who have advanced HIV or severe immunodeficiency, or patients who are actively being treated with high-dose corticosteroids, are eligible for a third dose of the COVID vaccine. Consult your doctor if you think you might have one of these conditions. The last thing I'll say about vaccination is that it is likely a booster will be coming this fall. We know from studying some of the early participants in the studies of the COVID vaccine that the immunity does seem to wane with time. Although, to date, it appears to be extremely effective. As I mentioned, 99% of those hospitalized with COVID since the vaccine has been released are unvaccinated. But we know over time that vaccine efficacy wanes. Science is looking into how to roll out booster shots. You'll hear more about this later this fall. Currently, the COVID vaccines are available without appointments at all of our local pharmacies. These are free to all people over the age of 12. You can get that vaccine at local CVS, Rite Aid, Walmart, and Hannaford pharmacies. I'll just comment a little bit about masking. Clearly, the spread of respiratory droplets does decrease with masking. At the current time, Governor Sununu is leaving masking mandates up to local towns and schools. I hope that we can remain respectful to our civil leaders and those who are doing their best to guide our schools, our towns, and our businesses through this fall, winter, and the years to come. In the healthcare setting, we have never stopped wearing masks, and we will continue to wear masks as we see patients. We thank you for your ongoing support, understanding, and participation in masking up when you seek healthcare. In closing, what can you do at the current time? If you've not been vaccinated, please do so. Encourage your family and friends to do so as well, so that we can put this preventable disease behind us. Until next time, stay well.